Hey everybody, I'm Dr. Richard Stevenson and I'm the Director of Education at Stevenson Dental Solutions. I'm also Emeritus Professor of Clinical Dentistry at UCLA. And this is our teaching center where we conduct many hands-on courses all year long. Today though, we're going to talk about the PFM preparation on Kilgore tooth number 8. And I think it's important to remember that the PFM needs to be prepared not only for the ceramic but also for the metal and the opaque. And we need measurements like 2 millimeters of incisal reduction, 1.5 in the incisal facial, 1.25 in the midfacial, and 1 millimeter at the shoulder area to accomplish an aesthetic restoration. Your lingual clearance needs to be between 1 and 1.5, and then we like to have a fossa that's a millimeter and a chamfer that's approximately 0.5 millimeters deep on the lingual. As you look at the preparation from the facial, we're going to need to have reduction that is going to be uniform across the front of that, and not only 2 millimeters off the incisal, but 1 millimeter off the interproximals as viewed from the facial. Let's keep the finish line 0.5 above the tissue and nice and rounded on the corners. I like to use a straight instrument to measure the reduction relative to the adjacent tooth. Now we're going to be working on tooth number 8 today, so it'll be really easy to match the level of tooth number 9. It's a little different if you're working on tooth number 7 and trying to match the length of tooth number 10. It's important to take a look at the fact that even though the typodont is equilibrated by the manufacturer, sometimes there's some space. We're going to look from the side often. This is one of the most important views that we have in restorative dentistry to reduce teeth properly for aesthetics. You notice that the lingual has a very beautiful large fossa and a small little axial wall. So we're going to talk about how to preserve that a little bit later. When we're finished, these marginal ridges will be reduced. You won't really see them in the final prep. The burrs we're going to use are the ones that are typically used at the University of Buffalo for their international program bench exam. And I thought I would try using them today. I think that this is a terrific system. It's been very well thought out by the faculty at Buffalo, and the shapes are ideal for a PFM preparation. They're efficient and properly shaped. So let's start with the 6847016, and I'm speeding this up a little bit because I need to get us through this video here in about 20 minutes. But this is the incisal reduction step, and step number 1. It's a pretty simple step, but it needs to be carried out in the right way in that we cannot reduce the entire 2 millimeters at the beginning. So let's leave approximately 0.5 millimeter for reduction at the end. This is the RGS4 showing you it's a little less than 1.5 at this step, and I think that's about right. Once we have finished this incisal reduction, let's start with the lingual clearance. And the lingual clearance is going to be done with the burr at a very steep angle. The angle will be much more than 45 degrees. This is about 45, and you're going to see that this is not enough. The Kilgore tooth is a very pointed tooth as viewed from the side view. So we're going to need to make sure that we have the burr angled dramatically upward to start gaining some lingual clearance, like you can see here. The RGS3 shows us that this is not even close to 1 millimeter. So we're just going to have to continue. And notice while the burr is reducing the lingual area, it's also touching the incisal area that we just reduced in the first step. So step number 1, 2, and 3, which is coming up, all have an impact on the incisal edge. Now we're getting a little bit better, but still not quite enough. It's important to know that this burr is 125 micron grit diamond, and it is going to leave some pretty deep scratches that need to be removed. So when in doubt, under-prepare initially and allow yourself some room for smoothing at the end with one of the 30 micron grit diamonds that we're going to be using today. The third step is facial reduction, and I'm utilizing the exact same diamond throughout these first three steps. This is the 6847016. Now the 16 means that the thickest or widest part of this diamond is 1.6 millimeters. The tip on this diamond is approximately 1 millimeter. So we can utilize this information to our advantage. We can use the tip to full depth near the gingival to give us the adequate amount of clearance. And then by tipping the burr towards the lingual, see the burr is being actually uprighted, and the handpiece, I should say, is being tipped towards the lingual. You'll see it right here. You see how it's rotating. That is going to allow us to get a differential in reduction at the gingival and at the incisal. So when you look at it from the incisal view, you will have removed more tooth structure at the upper incisal edge portion versus the gingival portion. Now it's just a matter of spending the time to remove all of the tooth structure in between these depth cuts. So we sped this up quite a bit to help you see how this is just pretty straightforward. I think probably the biggest issue with depth cuts is that you leave behind some of the depth cut when you are near the end of the preparation, and you have to always go back and get rid of those areas. Once you've got this facial reduced, let's talk about finish lines a little bit. And on the facial, we're going to utilize a shoulder, and a lingual, we're going to have a chamfer. And in the middle, we'll have this shoulder bevel transition area. And a lot of people get concerned about this, but I got to tell you, it just happens so easily. It's really not to worry. And we're going to go over that in a little bit of detail when we get there. But we are now ready to break interproximal. And this would be the fourth step. And for this step, I'm using the 850012, which is like a needle-shaped burr. It's a beautiful burr. It's got a nice round end to it. It's a long burr, so you can use it to get through the entire surface. When you're pushing the burr through, and we're just showing you from the incisal view or the occlusal view where these margin areas are, the shoulder bevel, the shoulder, and the chamfer. When you're pushing through interproximally, I want you to push the burr towards the lingual. Just keep pushing it straight back, as though you're pushing it to the rear of the oral cavity, and don't turn the corner. And this is really important, so that that way you're not going to over reduce the area which is supposed to be chamfer. So just push the burr straight through, and I think you'll find that you'll end up getting a more consistent result. Here I am showing you that straight through motion. I don't think there's any worry at all about going too deep axially when you use this thin burr. Probably want to leave about a 0.3 millimeter to maybe 0.4 millimeter shell on the side to make sure you don't go too deep axially, but I have rarely seen anyone have a problem with this. And you can easily estimate where the finish line is going to be at the gingival, and so when you start entering with this interproximal burr, you don't have to worry about going too deep axially. It's always important to hold the handpiece in the line of draw of the intended preparation and allow the burr to do the tapering. So here we are back doing a little bit of refining, trying to get this axial reduced more to the 1 millimeter at the gingival requirement that we want. And we're back to the 6847016 burr. And we're holding it along the long axis of the tooth. The line of draw is being properly maintained so that we allow the side of the burr to do all of the prepping for us. you know, you've got plenty of room, and you should, even though you see the burr getting almost dangerously close to the lateral incisor there, fear not. You should be able to place the burr between the teeth rather easily without hitting the adjacent tooth. And I think that that's extremely important. And when we're finished, the tip of this diamond should be fitting all the way in to the axial on the mesial and on the distal. You can see on the distal it's a little bit closer to where it needs to be compared to the mesial. You notice that the burr is angled so that the tip is perpendicular to the unprepared facial root surface. We can look at this from the incisal and see areas where we need to reduce more, because as we're going across the facial, it is a little bit difficult to make this exactly uniform on your first pass. So you may have to go back over it a few times. Not a problem. And now that we are in that 1 millimeter ballpark, and we can verify this with an RGS-3, the RGS-3 is exactly 1 millimeter wide, plus or minus 10 microns, I think. And that shows you that it's almost there. Maybe just a little bit more smoothing we can do later. Remember we talked about the shoulder chamfer transition area. Well, let's just take a look at this as we work on the lingual aspect of the preparation. Understand that the contact areas are going to need to be included in the shoulder design. And about midway through the contact, you're going to transition into this shoulder bevel area. And it's sort of this small, maybe 1 to 1.5 millimeter zone where that's going to happen. And the green line is depicting that the bevel that we place is going to fade to 0 as it reaches that area on the facial. So let's start with step 5, which is the lingual reduction with the 6878K016. I'm just measuring the tip of it to show you that it is 1 millimeter, which means that half of this will give us a 0.5 millimeter chamfer. And a chamfer design with a 60-degree downward inclination is optimally achieved with this particular burr. It's perfect for the 0.5 millimeter chamfer with the exact form that you're looking for. So it accomplishes both dimension and shape. Make sure you do hold this along the long axis of the tooth so that you're not creating an undercut or you're over tapering in this particular step. As you get close to the interproximal, you're going to notice that the side of the burr will leave the axial wall in order to create that chamfer shoulder transition. And I promise you I'll show you a little bit of a closer view of that. Looks like things are going along pretty well here. Those little corners are kind of aggravating, and it's really important to, when you go around this tooth, and we'll do it again as well, but to round off that edge of the axial wall when you're prepping. Get the finish line really close to the tissue, about 0.5 millimeters, so we can maximize the height of the cingulum wall, in other words, the axial wall adjacent to the cingulum. And that's essentially the end of step number 5. So now let's move on to step number 6, which is the lingual fossa. And we're showing here is the 6379016. It measures 2.25 millimeters at the widest area, but only about 1.5 millimeters at the tip. So let's use about half of the tip to get the proper depth that we want on the lingual. So I just make a little stripe down the side. It could be on the midline, could be a little bit off to one side like I'm doing here. And you can get a really good idea of adequate clearance and reduction. When you're using this burr, you do want to remove the marginal ridges completely and have them flat. Don't replicate the marginal ridges in your final lingual morphology. Also, don't over-engage the cingulum because you'll lose axial wall height and retention. Before we start finishing, let's evaluate what we've done and see how well we've accomplished the goals. And from this view, you can see that the facial reduction is a bit under on that incisal 1/3 area of the facial. It's not quite 1.5. So we're going to go ahead and start with the 8847-016 on the facial to remove the deep scratches left behind by that first diamond that we used, which was 125 micron grit diamond. And if you can use the high-speed handpiece really slowly by not pushing down the pedal all the way, or perhaps use a slow speed with a friction grip attachment for your slow speed motor, or even use the electric handpiece with the speed turned down to about 20,000 RPM. I think you'll find that you can accomplish a lot of really good smoothing at this stage. The key is, don't create an undercut where you didn't have one before. And sometimes what happens is, as you're trying to refine that shoulder on the facial, you'll create a little undercut. This is the finishing diamond that is corresponding to the chamfer area. So this would be 8878K016. Once again, it has a red stripe on it, and it just does a beautiful job of smoothing this area. Remember to round off those little corners right there. This gets forgotten by a lot of people, particularly clinicians in practice. So this is the incisal reduction area, and we're getting that last little 0.5 millimeter or whatever it is that we need. And this is the end cutting, which is called the 8879-012. Now I would recommend you use this diamond with caution, because if you use it to do a lot of smoothing, it can create little circular irregularities at the gingival. So take it easy with that. Now we're going to utilize the 8379-016 to create a very nice and smooth fossa. Now I've painted the lingual half of the tooth with a green dry erase pen so that you can see the area of reduction very clearly, and the areas where you're not supposed to touch. Don't touch that upper part or lower part. About 1.5 millimeters rectangular area is still left there. I think I want to show you a little close-up of how to create that little bevel there. I just did it, but right here, there it is. That's the little shoulder bevel transition into the chamfer, right there. Now let's get real close and take a look at it. So you can see we're hugging along the finish line, and as we go out towards the facial, we pick the burr off of the axial wall so that just the edge of the burr touches the side there, and then you pick up the burr. Same thing here on the other side. So you're hugging the axial wall, moving the burr along, and then as you get to that little part here, interproximal, the burr leaves the axial, but the tip is still touching the finish line. And then one of my favorite things is to utilize some kind of a composite finisher. This is a Jiffy Cup Green. I don't like using anything more smoothing than this. This is going to leave a slight matte finish. It won't really polish. It'll finish and smooth the tooth. So you can use this or a comparable type of composite finisher. And you can round off some edges, you can straighten out the edge here, and then we can check all of our measurements and make sure that we're in good shape for this preparation. And I think it looks pretty good. We've, I think, achieved the measurements that we're looking for. 1 millimeter shoulder on the facial, 0.5 millimeter chamfer on the lingual. You can see that the side view shows that the reduction is appropriate, and it's a fairly smooth preparation. It looks like it's going to have adequate reduction, lingual clearance, and all the things you need to have. It's got about 1.5 millimeters of lingual clearance, definitely more than 1 millimeter, and that is awesome. So those were the 7 steps for this preparation: incisal reduction, lingual clearance, facial reduction, proximal clearance, lingual axial reduction, lingual fossa reduction, then finally the finishing. I hope this video was helpful. I think this preparation, if you handle it systematically following these 7 steps, you can end up with a result that will be clinically acceptable and hopefully even go beyond that into the realm of excellence. Thank you so much, everyone. Take care.